Good afternoon, everyone. I am Dr. S.V. Chaitanya, consultant urologist at Care Hospitals, Mushirabad. Today we will discuss something about kidney stones. As we know, summer is approaching us fast, and this year the expected temperatures will be soaringly high. So we are expecting a lot of kidney stones to occur. So I thought this would be a good occasion to discuss about them. So let us first discuss about some basic points. We all know there are two kidneys in our body, and the normal function of kidneys is to produce urine, and that urine goes through two small tubes, each per one kidney, which is called ureter, and that goes to bladder, and to the bladder through urethra, then the urine passes out. So normally in the kidneys, each kidney, there are some room-like portions where the urine exactly comes out. These rooms all join into a single tube into ureter. So the room is the exact area where the stones are formed. So what exactly are the stones? Stones are nothing but the normal things which the body excretes in urine. When it forms a crystal, the crystal grows in size, forming a stone. So those are nothing but the various minerals and waste which our body normally excretes. So when the capacity to dissolve them exceeds, automatically a small nidus or crystal will form, and that nidus, when the crystal gets bigger in size, the stone forms, and from the room the stone moves into the tube, producing the symptoms. So who all are at the risk of formation of stones? There are many risk factors, but practically speaking, in a normal individual, we can come to a conclusion that there are main three factors which play a vital role. One is the water intake. We know that water has a tremendous capacity to dissolve many of the substances. So when one takes good amount of water, automatically all these substances are dissolved and they go in urine without forming any crystals. While one does not take water, even those things which dissolve in water also, they can form a crystal leading to stone formation. So water plays a vital role whether one is prone to form stones or not. And the second thing is the food which we eat, which we'll discuss it later. And third, and the thing which is not in our hands, is our genes. So endogenously, some are prone for stone formation. If you notice, in a family, only one will produce stones frequently, while the other family members will not have stones. It is because his gene profile is such a way that he produces stones. So we cannot do much regarding the genes. So leaving it apart, he must take other precautions to prevent it. So to summarize, there are three factors, that is the water we take, the food we take, and our risk or inherent risk due to our genetic profile. So stones are frequently seen both in female and male. There is no much difference. And as we are seeing that there is a tremendous increase in stone formation. Studies expect that in India, about 9 to 10% of whole population may have stone at some point of time, which is a huge amount. So how do you know that one has a stone? Or in other words, what are the symptoms one can have when there are stones? The symptoms depends upon the location of the stone. Normally, also if you screen the entire population, maybe nearly 30 to 40% may have stones. But it does not mean that all will have symptoms. And but do we need to really worry about all stones? No. Suppose if there are small stones sitting in the side of the room, as I told you before, then they generally do not cause much symptoms, and there is nothing to worry about acutely. Though he must know that he has stone and that it can produce some symptoms, and he must take certain precautions. But when these stones grow in size and they move into the tube, that is when it is going to produce symptoms. So what are the common symptoms which we see? The commonest symptom is pain. Pain in the sense it is very acute pain. Probably it is one of the severe pain one would have ever had in his lifetime. The pain typically starts in the back and it comes to forward, radiating to front, and it is maybe associated with vomitings, or sometimes the pain may radiate to testes or thigh, and if not attended, even it can lead to infection, leading to fever, and some may also have some blood in the urine, and some may also, when not attended, that can cause acute obstruction of kidney. That is, the urine will not pass through the tube due to stone, and there might be large swelling in kidney, leading to vomitings and sometimes failure of kidneys and so on. And it will be surprising to see sometimes there might be no symptoms, and incidentally they're just found on the scans. And apart from these, when the stone passes from the ureter and falls into the bladder, it can get stuck in the urethra, leading to retention of urine. That is, the person will not be able to pass urine. So when we have to actually worry when there is a stone, as I told before, just the presence of stone, we need not worry much. But when there is a stone in the ureter causing obstruction, that is, when there is swelling in the kidney because the stone blocks the flow from the kidney, then the urine gets accumulated, leading to the swelling of the kidney. That is when we have to worry. Like it may not need an emergency surgery, but that stone must not be there for more than 6 weeks. If it is there due to the swelling, the kidney also gets affected. So once there is a stone obstructing the kidney, we need to consult a urologist and then take some treatment. So what are the various treatment options available? The various treatment options generally depend upon the size, location of the stone, and the profile of the patient. For suppose patient has a single kidney, or he has already has underlying diabetes, his kidney function is low, the treatment options will be different. While in a fit young individual with no other comorbidities, the options will be different. So generally speaking, when one presents with acute pain, the first thing we do is to give some painkiller to see that the pain subsides. Then we evaluate. When in the case of acute pain, we may get a CT scan to see the exact location of stone and so. If it is not acute pain, we may also get a ultrasound to get a rough area, and if at all needed, then a CT scan. With the CT scan, we will know the exact site of the stone, size of the stone, and how much obstruction is causing, and and any infection in the kidney also we can get to know with the CT scan. And we also order routine function tests. So all these tests we will know how much obstruction is the stone is causing, and is it producing any effects on the body, say rise in the creatinine or any infection. If at all a person has a severe pain, it is not relieved by the medication, or this stone is causing other side effects like infection or kidney injury or sepsis, then we may have to go for some intervention at earliest. If at all there are no other things and the stone is small, generally the cutoff which we take is 5 mm. If the stone size is less than 5 mm, what we do is we generally give some drugs. Generally what we need to understand is, if the stone is less than 5 mm and the stone is located in the tube, then there are certain medicines which make the diameter of the tube to expand. So the tube which I told you is almost a 25 centimeter tube that connects the kidneys from the bladder. So the stone has to travel it. Generally most stones in the tube, they do not dissolve, but they get expelled. So to help in expulsion, we give certain drugs so as to relax the ureter and so as to increase the diameter of the tube so that the stone can pass into the bladder. So these medicines, the good thing is, if at all the stone fall away, we can avoid procedure. If they don't fall, then we know to go for procedure. But the thing is, the stones which are located up above near the kidney, with medicines only, they are not that effective. While if the stone is less than 5 mm and it is located very close or near down lower part of the ureter, then nearly 70 to 80% of stones may pass away with these medicines. And what we have to be compulsorily, the thing is, if you take medicines also, and if the pain gets subsided also, we need to confirm for sure that the stone has passed away. Sometimes what happens is the stone may remain there, causing a postural obstruction, so no symptoms, and we may think the stone has gone away, and only 6 months later, when the kidney starts not functioning, we may get symptoms. So if at all we are using medical therapy for ureteric stones, it is always compulsory to get rechecked that the stone has passed away. That's very important. Suppose if on taking medicines also, if the stone does not go away, then we may have to go for a procedure. Nowadays all procedures are laser based, or in other words they are endoscopic, wherein there is not even a single scar on the body. We go through the urethra, that is the channel through which urine comes, and then we blast the stone with laser or pneumatic lithotripsy. We blast into stones and we put a stent. Generally most of these procedures are day care or single day care, most of the case, unless the patient has severe infection. But this procedure may not be applicable to all. Suppose if there is a large stone in the kidney, then we may have to put a small hole on the back into the kidney, and through the hole we pass the laser, blast the stone into pieces, remove the stones. And apart from this, for very other small stone kidney, we pass in shock waves. That is, we don't pass into the body, we give small anesthesia, and the shock waves are passed externally, which is called ESWL, and the stone gets blasted into small pieces, and these pieces pass into urine. While rarely for very large stones, sometimes we may have to do open procedures, but all these procedures are generally safe, and the recovery is fast, especially in all endoscopic procedures with minimal side effects. So it is always better to show to a urologist once you develop a stone, and he will take a decision, shared decision, whether you need a procedure or you can try medically. And if it is procedure also, instead of delaying that the procedure may cause complications, if you get removed, it will be better. The kidneys will be safe. So there are some people who form recurrent stones. Is recurrence common in all? It may not be common in all, but what studies are saying is, if one person has stone, and though he may get removed successfully, the tendency of him having a stone again is 50% higher than the normal population. So if one is having stones, he has high chance that he may have recurrence again. So are there any methods to prevent recurrence? In a recurrent stone formers, we must first try to find out if there is any actual cause. As I told you, there might be some genes, or he may be prone for stones. Apart from it, there might be some metabolic abnormalities that can be detected by doing metabolic evaluation, wherein we collect the urine for 24 hours and do certain tests if the calcium levels are high, or if he is producing high uric acid. We may do certain tests, and if at all we find those, and if we can correct that, maybe the stone formation rate will be coming down. Or else the other general measures which we tell to the patients is, first important is increasing water intake. So one must drink good amount of water such that the color of his urine is always white. That is the amount one must take, provided he does not have other problems like cardiac or renal disease. The amount of water must be such that the urine color is always white, and it is not that he takes all the water at once, because once we take water, that water comes into kidney say by 1 or 2 hours, and many might be thinking that we will drink 2 liters at once, and next the whole day we will not drink, and again we will drink. That is bad. Instead, it is better to take a glass of water every 1 hour, and depending upon your work and the quantity you sweat, you can adjust it accordingly, seeing that the color of the urine is always white. And coming to foods, the commonest stones which are formed are calcium oxalate stones. So for that we ask them to limit the oxalate rich sources. The commonest oxalate sources are nuts, chocolate, and cabbage, cauliflower, palak, spinach, which we ask to avoid. And these all are long-term measures. So these are not that if you just start doing for 1 month, it will be okay. You have to inculcate in lifestyle, then only you can have these fruits. So by these measures, we can prevent recurrences.